This is a dissemination or sharing of the research findings on the project which was on enhancing inclusive education for children with disabilities in the Dodoma region. So the gravity for this project originated from the fact from the both international and the national efforts in enhancing education as child rights to the people or persons with disabilities. So those rights are enshrined in the United Convention for the rights of people with disabilities, the UNESCO, and the education for all, but also in the Sustainable Development Goal number 4, that strive for achieving quality education or ensuring inclusive and equitable education, and they promote lifelong learning opportunity for all. That is including children and the persons with disabilities have the right to quality and better education. But Tanzania, as part of the international community, has also made several efforts to ensure that her citizen has access to education, and this has been precipitated by the enactment of the National Policy on Disability, ratification of the United Nations Convention on the Rights of Persons with Disabilities, but also the enactment of the Persons with Disability Act of 2010. On top of that, Tanzania's commitment to ensure education for all has also been emphasized with the National Education and Training Policy of 2014, but also the National Strategy for Inclusive Education of 2013-2017, that was revised in 2018-2021. So it was through those international and the national atmosphere on emphasizing the rights of education to all that culminated for the atmosphere for inclusive education implementation in Tanzania. Despite that inclusive education is not only access, but also the freedom of participation or inclusivity at the family level, school, and the community initiative. That is to say, when we are talking about inclusive education, we should not only focus on the accessibility of education to children with disability or persons with disabilities, but also the level, magnitude, and the degree of inclusivity, starting from family level, how the family members perceive and accept the person with disability, the community around that family, but also at the school environment, how do the teachers, fellow students perceive and treat persons with disability. So access itself is not an issue, but also the level and the freedom of participation and engagement of persons or children with disability is very important. So in order to achieve this, there should be multiple actors in enhancing or in promoting inclusive education. And some of these actors include participation or inclusion of the community volunteers. It should be known that over the decades, the efforts and the support in formal education, accessibility to formal education, has been in the role of teachers, parents, governments, development partners, particularly religious affiliational groups. But also, the notion of community volunteerism in education has been for foreign or foreigners and higher education volunteers, especially those who are requiring training and specialization, without considering involvement of the local people, of the indigenous people, to work as volunteers. So, neglection of using the local community volunteers, it has been found that this approach does not adequately involve all children with disabilities to participate in education or in school, especially at community levels, because once the foreign volunteers, their contracts or projects come to an end, means that efforts, that follow-ups start to decline due to close follow-up. So, consequently now, it was imperative in this project of which we have conducted the research to involve community volunteers who have a touch to the grassroots level, at the family level or at the local level, to easily encourage the parents, to encourage the teachers, the local leaders, to send the children with disabilities in the mainstream educational schools, and to ensure sustainability of the initiatives towards inclusive education. To that matter, therefore, this study explored the contribution of the community volunteers as catalysts or as advocates in enhancing inclusive education for children with disabilities in primary schools in the Dodoma region. Specifically, the study had 3 objectives, which was to assess the community volunteers' perception toward the education for children with disabilities, to evaluate their roles, that is the roles of the community volunteers in enhancing inclusive education, but also to assess the challenges they faced in supporting implementation of inclusive education. So this study was conducted in 10 primary schools in Chamwino District and Dodoma City, in Dodoma, in Tanzania. Maybe to give a brief, this was like a follow-up to the inclusive education project or intervention project, which was implemented by the Leonard Cheshire in London in collaboration with the Tanzania Cheshire Foundation. Those were doing intervention, and then the UDOM team was making a follow-up to assess if the intervention was working or not. So data were qualitatively collected from 17 informants who were the community volunteers through focus discussion. Informants were purposefully selected based on their batch of being involved in the inclusive integration project. As I said earlier, it was implemented by the Cheshire Foundation, Tanzania Cheshire Foundation, in collaboration with the Leonard Cheshire in the UK. And the project was funded by the Comic Relief, also found in the UK. So before involving the community volunteers in implementation of the project, they are first trained or oriented on the basics of inclusive education, disability issues, rights of children with disabilities, as well as on some skills, basic skills on community sensitization. So data collected were thematically analyzed and presented in verbatim. And the findings show that in terms of community volunteers' perception, the findings show that community volunteers perceived children with disability as having a right to education, as other children do, but also they are positive, and they're committed to ensure that or to facilitate community children with disabilities access education in the community as others. Some of their role, it was found that they served as a catalyst or advocates in changing attitudes among parents, teachers, community leaders, and the public at large pertaining to disability and education for children with disability, that is inclusive education. But also they worked as a focal point from which information on a specific child with disability could be obtained and intervened. But also they are doing lobbying and advocacy for children's rights to ensure education and health, and as well as social issues related to the children with disabilities. In terms of challenge, they reported to have challenge related to transport, that is moving through households to identify those children and giving services, but also lack of outcome support from parents, because they thought that the community volunteers, because they're interacting with those white men, they think that they're receiving a lot of money or incentives, so sometimes it could be a challenge to get support from the parent and other community members. But also they were given a small dose of advocacy, so they lacked more advocacy skills to ensure that what they are doing is comprehensive and functional. So our study came to conclude that community volunteers are highly needed for success in the sustainability of inclusive education, as they serve as an important link between the children with disabilities, parents, teachers, and other community members during identification and focus, education, and even support for children with disabilities in the communities. And this model was recommended to be emulated by other projects in the community level, so that to ensure sustainability and a quick feedback. In terms of recommendation, the study recommended that community volunteers need to get more advocacy and the skills for children with disabilities, but also they need to be involved in planning and implementation of school and the village-based projects, so that they become aware which one is the right for the children with disabilities, and then to get more knowledge and a wider scope on how to lobby for the rights of the children with disabilities. But also they needed more training in advocacy in terms of child rights, in other social skills related to health, environment, civic education, to enhance positive interaction in the community with an eye open to education for children with disabilities. Having said that, that marks the end of my presentation. Thank you very much for listening.